Right. Recording.
As a patient,
Is it?
we are going
Yes, now.
to do the history taking, right?
So, yes, history taking. Timer has started, and here is your question.
Are we going?
Sorry?
So, who will act as patient?
Wait. Who will wait? Is it stopping or what? The question. Right. If you have read and understood, kindly begin your history taking.
Hello.
Hello.
Yeah, I'm Dr. Prabjit. I'm one of the surgical doctor over here. May I know your name and age, please?
Yes, my name Lisa Smith. I'm 20-year-old.
Hi, Lisa. How can I help you today?
So I have lost a stool this multiple time, I think 8 times in the last day.
Okay. May I know when did it start first?
This is not the first time. I have the same episode before, but this time is yesterday I started.
Okay. Was it sudden or did it increase slowly?
It's suddenly.
Okay. So your main problem is the loose stools, right?
Yeah.
Okay. Anything else along with stools you had?
Yes, I have some abdominal pain. It's my tummy pain, and I recognize blood in my stool.
Okay. Okay, fine. So did it increase over the time or decrease or was it same?
Yeah, as I
Is it
said,
continuous?
I have a previous attack like this one, and this one today before yesterday is more severe.
Right. So anything which makes it more or decreases it?
Um, no, not as I remember.
Okay. Right. So could you tell me where do you feel the pain exactly in your tummy?
All
Right. Stools. What was it? Was it watery or what's the
yes,
consistency of the?
yes, watery.
Okay. Right. That there were 8 episodes.
Yes.
Right. So could you tell me the character of your tummy pain? Was it dull pain or sharp pain? How was it?
Now is a colic pain is come and goes.
Okay. Do it moves around in the abdomen or it's all over the same place?
Oh, no, all over the abdomen all the time.
Do it change with the time of the day, in the morning or evening? Do it changes with the time?
It's not related to the time of the day, just come and go.
Is it related to vomiting? Did you vomit along with it?
No, I don't have the vomit.
Anything which increases it?
No, nothing.
Did you travel somewhere recently?
No, sorry, doctor.
I said,
Sorry, I don't get.
did you travel recently over any other place, or were you at
No,
home?
no.
Okay, so right. So is it related to stress, or do it increase with stress or something like that? In the stressful situation, the diarrhea and everything increases or not?
I didn't have any stress really.
Okay. And do you feel any swelling in your back passage?
No.
Okay. And do you have any change in your bowel habits, constipation or diarrhea recently?
Yes, doctor, I tell you that I have a watery diarrhea time the last day, and I have the same attack before.
Bleeding from any other orifice?
I recognize the blood in my stool.
How much was that? The amount of the blood, full or cup full? How much was it?
It's difficult to say how much amount. Is a little bit, not more.
Mm-hmm. And so apart from that, did you have any other problem?
Like what?
Like this, abdominal problem or chest problem or anything else?
I don't have any chest problem.
Okay. And was this the first time this happened to you, or anything similar to this happened in the past also?
I tell you, I have attack before that.
Okay. So may I also know any kind of medical problem you have earlier? For example, chest pain or something you went to GP for?
Yes, sometimes I have a heartburn. I take some anti-acid for this heartburn.
Mm-hmm. Okay.
Yeah.
And any
Yeah.
surgery you had previously?
No.
Any medication you are on right now?
Nothing.
Okay. Any allergy from any drug or medicine?
Not as I remember.
Mm-hmm. I hope you don't mind. I want to ask you a few personal questions. Is it okay with you?
Yes, it's
Okay. What's your occupation?
I'm a teacher.
And who lives with you at home?
My husband.
Do you smoke or do you drink?
Yeah, smoke and drink occasionally.
How many packets per day do you smoke?
It's not packet. I have just 10 cigarettes per day.
And how many units of alcohol do you take in a week?
Occasionally, not always.
Right. So any similar history or similar kind of problem in your family with your maybe sibling or in your parents?
Yes, my father have a bowel problem, and he have operation to remove his bowel.
Okay. Do you know what the problem was? His diagnosis, if you
I don't
remember?
know. I didn't know it.
Okay. So right, Lisa. From these questions, we have some idea, but I want to know further. Do you know what do you think the cause of your problem is? Do you have any idea?
I didn't know really what's happening for me. Just I want you to resolve this problem. If you can do for me test or
Definitely,
X-ray.
we'll do that. First, I want to complete my history part, the questions. So, what's the thing which you are most concerned about?
I'm really tired because it's eat time watery area. I couldn't go to my job. I'm really tired.
Okay. So, what do you expect from us today?
Help me, yes.
Sure. So now I also want to know if you have any chest pain or cough or any breathing difficulty,
No, doctor, I tell you, I don't have any problem with my chest.
any problem with passage of urine.
No.
Okay. So anything else you want to tell me?
I just want to say that I have lost 10 pound of my weight on the last 6 weeks. I don't know this is related to the
Yeah, that's that I will take that into consideration. And do you have any decrease in your appetite? Do you feel eating less?
Yeah, I didn't
Right.
eat well. Yeah.
Right. Thank you so much, Lisa.
Okay.
We'll come back to you after getting some tests and further examination. We'll let you know about the problem. Okay. 20-year,
Yes.
yeah, 20-year female who presented with the bleeding per rectum with the watery diarrhea and abdominal pain for 6 weeks now, and she has lost weight, which is unintentional over the last 6 weeks. The stools were negative for infection. It's not related to any travel history. It's not related to any bleeding or from any other orifice. She does not have any kind of anal problem. There is no history of itching or any swelling. It's not related to hemorrhoids. So basically, my main diagnosis is, and because she's having a family history of abdominal problem in father, for which the colectomy or intestine. Yeah. So my main diagnosis is CA colon. And in differential, I would like to keep inflammatory bowel disease, diverticular disease. It could be because of anal causes like hemorrhoids or maybe fissure, and diverticular disease and
So
bleeding
how do you
tendency.
think this patient should be managed?
First, I would like to do a proper abdominal examination.
Yes.
Complete abdominal examination. And along with that, I would like to have some blood investigations and radiographs. In the blood investigations, I would like to get full blood counts, in which I could see the signs of anemia, or I can see maybe platelets are low in bleeding disorders. In biochemistry, I would like to get urine and electrolytes, LFTs, and maybe ABG.
And what
I
treatment
also
can
would,
you offer to this patient?
so if it comes out to be, I would like to go for staging of the cancer and the endoscopy, colonoscopy, biopsy first, to make it sure action of the bowel, mainly surgical treatment, as there is history of a similar problem in the father. So basically, it will be surgical resection.
Okay, good, thanks. History taking you have done very good of presenting complaint. The remaining you took too much time. You have idea, first bell went at 6 minutes and then I gave you 2 minutes again. You were still taking the family history and other history.
Yeah, it took long.
Yeah, and then you
Yeah,
took 40 minutes extra, so 2 minutes and 40 seconds. In the remaining 20 seconds, you started presenting your case, and then I gave you 2 minutes more. So that is all right. Practice here, but my point is to tell you, you all know, because this is you are doing every day taking history, but like even I consider 1 minute out because we're doing digital and person understanding and answering, still you have taken more time, so we have to cover it
Yes.
within the 6 minute. This is like my request. Like want to practice it that much. Now coming to this one, why you had chosen to tell me about your first provisional diagnosis as cancer when the patient was 20 years old and there was no significant past medical history. Maybe because she lost 10 pounds of weight over the 6 weeks. Is
And the
that
history
why?
of colectomy, as told by the patient in
Well,
father.
that was for father, not for her.
yeah,
Because
it could be a cancer in his father. It's
not necessarily
related.
her, because I made this for irritable bowel syndrome, IBS.
Yeah.
There was no history of stress or anything in the patient. I ruled out
Okay,
because of that.
yes, very good. Yes,
So
irritable
one
bowel
was
syndrome,
10 labs.
irritable inflammatory bowel disease could be, but then that is another one, yeah. Okay, there was no stress.
Yes. So it was, did you make it for inflammatory bowel disease or irritable bowel syndrome?
I think I have written
Inflammatory
IBS,
bowel
but
disease.
then it must have been inflammatory bowel disease. But then they are saying it's no significant past history. In generalized abdominal pain. So
So
that's
because
why.
there was loss of 10 labs in 6 weeks, which was
Yes,
unintentional, and
yes,
bleeding, two things, family history. So it could be
yes, could
familial
be. Yes, all right,
carcinoma.
I'll
That's why I
accept you
thought of it
because it
first time.
can, yes, it can occur even at the age of 20, even earlier. But I was just thinking if this question comes, so always when you give your first provisional, yes, yes, sure, you can go next. When you are giving diagnosis, always think for a reason why you have given this as your first diagnosis, and then second and
Yes,
third, so you can justify yourself. That's all.
true.
Thank you. Yes.
Thank
Anyone
you.
else want to give feedback to doctor?
Yes, yes,
Yes,
me.
please. Yes, yes.
Uh, um, Firstly, thank you. You will do it well. But you repeated a question more than two times, three times, the same question, and you are consuming your time
Which
in
one?
this
Which
way.
question?
Like abdominal pain, abdominal pain.
No,
Three
no,
times
no.
I explain.
Abdominal pain. He has to ask, and then he has to rule
Yeah,
out
yeah.
if it's.
I
Yeah.
explain. I mean the character of the pain. I already explained the character of the
Okay.
pain, and again he asked me about pain.
Yeah, I think, I agree with Dr. Zaid. It's basically because all the lists that what to ask that comes in the mind, and rather
Yeah,
than
yeah.
asking the, yeah.
I know you do
So
it like this, and we are do it like this
I got your
because
point.
yeah, you
So
ask and
could you help,
remember
could you,
something and
could you help me in that? How could we improve on that? If you can tell that, I mean, how can
you,
we improve?
you just try to listen for me carefully. Sometimes I give you an information, you don't ask about again about this information. I already give it to you.
Right,
Yeah,
of
right.
course.
Just to recognize it and do it. Another thing, when you are explaining the investigation, don't explain why you will send this investigation because you didn't have a time. Don't say I
True.
will send for CBC because I want to see for look for anemia, for thrombocytopenia, for
Hmm.
necrocytic anemia, for this because
Yeah,
you didn't have
Very,
a time.
yeah, yeah. Just mention
true.
the test quickly. If examiner asks you why would you do that, then you tell them.
Yeah,
To the point, straight answer.
just
Okay.
to say the CBC, for example, culture, stool, and sensitivity analysis like this, but
Hmm.
don't explain why you are
Yeah,
sending.
if the examiner wants to ask specifically, then we can explain.
Yes,
Yeah,
yes,
Otherwise, we'll consume more time.
in
yes.
general, he don't ask you why you send this.
Normally they would not,
Okay.
Yeah,
but
only
Right.
like,
if you have a time.
yes.
Okay.
And that we
Right.
have to do practice, that we to take
Yes.
history taking, complete history taking, that is within given time.
Hmm. Right.
Good.
Thank you so much.
Thank you. Okay, can I have the next? Hello. Yes. Are you ready? All right. Started the timer, and here is your question. you have read and understood, kindly begin your history taking.
Yes, ma'am. Hello.
Hello.
Hi, I'm Dr. Varki, one of the surgical doctors here. May I confirm your name and age, please?
Yes, my name is Jonas Smith. I'm 54-year-old.
How may I help you today?
Yes, doctor, I have a problem with my swallowing. I can't swallowing food properly.
Oh, I see. How long have you been having this problem?
I started a month ago.
I'm sorry, I didn't hear you.
10 months ago.
10 months ago. I see. Was it a sudden onset or was it just insidiously or gradually?
Yeah, it's gradually start difficulty to eat hard food. Now even the solid food like juice, I couldn't drink it well.
Okay. Um, so you are saying that you had initially you had difficulty with the solid foods. Now you are having difficulty for liquid foods,
Yeah,
right?
exactly. Yeah.
Do you have any pain while swallowing?
It's not pain, just discomfort.
Uh-huh. Have you? Is this associated with any vomiting or?
It's not no vomiting. I just sometimes I regard the food. I recognize the same food. It's not vomit.
I see. Have you noticed any swelling in your neck?
No,
No. So, and have you noticed any recent onset of bad smell, bad odor coming from your mouth? Any difficulty like that?
sorry, I don't hear you.
Hello. Have you noticed any recent onset of bad odor coming from your mouth?
No, no,
I see. Do you have any joint pain or back pain or any eye problems, anything like that?
no.
Have you noticed any recent loss of weight, or and how is your appetite?
Yeah, with this problem, I couldn't eat well. I lost my appetite, and 2 months ago, I noticed I lost 2 stone of my weight.
Uh-huh.
Yeah,
So, have you do you have any abdominal pain or any um, difficulties like that?
no.
Do you see the GP for any other medical conditions, or are you taking any medicines for any problem?
Yes, I have high blood pressure. I take a medication for this, and it's regular, controlled.
Okay, fine. Have you had any surgeries in the past?
No, I don't have any surgery.
And does any of your family members have this kind of disease or a problem like this?
No, no, no one.
Do you have any drug allergy?
No.
Okay, fine. So I would like to ask a few personal questions if that's okay with you.
Yes, it's okay.
What's your occupation?
I'm a teacher.
Good. Then who all are staying with you at your home?
My wife and my children.
Uh-huh. Do you smoke?
Yes, smoker.
Cigarettes per day or is it packets per?
One packet per day.
Okay. And consume alcohol?
Occasionally.
Okay. 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 That's fine. I got a few more questions to you, but what do you think might be the cause of your problem?
Yes, doctor, I afraid because I lost my weight. I couldn't eat well. I think there is something wrong happened.
I see. So, about what are you most concerned about?
Yeah, I afraid there is something serious like sinistrous thing.
I'm sorry,
Like a
I didn't get
cancer
you.
or anything serious.
Oh, I see. I see. Okay. Uh-huh. So, what do you expect from us today?
If you can send for me some radiological film or investigation.
Sure. Sure. Before that, I would just quickly ask a few more questions. Do you have any chest pain?
Sorry, I don't hear you.
Do you have any cough or chest pain or shortness of breath?
No, no, no. I don't have.
Do you have any difficulty in passing your urine?
No,
Is there anything else you want me to know?
nothing.
Well, thank you, John.
Thank,
Anyway, I will get back to you. If you need any help, please let the nurse know. Thank you.
thank you.
Okay. Can you please present your case now?
54-year-old gentleman who is a known case of hypertension, well controlled on medication, presented with complaint of difficulty in swallowing for the past 10 months. It was progressive, gradual onset, and initially it was difficulty only for the solids. Later on, it became difficulty for the liquids as well. There is associated unintentional loss of weight and loss of appetite. There is no history of any lump in the neck or halitosis. There is no history joint
So,
pain or neck pain or any other eye disorders, and the patient is concerned that he is having cancer. Based on the above history and concerns, I would like to keep cancer esophagus as my first diagnosis.
okay. What other differential diagnosis would you consider?
It can be a thyroid neck swelling, like a thyroid swelling, or it can be pharyngeal polyps or motility disorders like achalasia cardia. Then,
Okay. How would you investigate?
then
What investigations would you ask for this patient?
I would like to do endoscopy, OGD scopy for this patient, and if possible, take a biopsy. Then other investigations include complete blood count, renal function and liver function tests, electrolytes, and radiological investigation like barium swallow, then chest and X-ray abdomen, erect, and if
And
needed, CT and MRI scan as well.
okay, how should this patient be managed? What treatment options can you offer?
Initially, I would like to confirm the diagnosis by doing the and stage the disease if it comes out as cancer esophagus by taking MRI and CT scan. And initially, I like to take care of the nutrition by giving NG tube, nasogastric tube, um, uh, some jejunostomy tube. Then I would like to manage the patient surgically if it is surgically treatable. If otherwise, palliative treatment and post chemo radiotherapy for
Very good,
surgery.
very good. Yes. Dr. Zaid, would you give feedback first?
Yes, I think he asked me more than one question in the same time. For
Okay,
example, yeah, he asked me, you have any
that's
chest
all right.
pain, abdominal
To
pain,
save
and like,
to save his time, his technique I think was excellent.
yeah, just yeah, he do it well. Just I want
He did well.
to, yeah,
He even completed the history taking within the given time. 15 seconds. He just I don't know why he just took saying to you that, okay, he'll get back to you. Otherwise, if he would have just finished it there and he would have turned to me and would have presented his case, so it would have been better. But it's just that. Otherwise, yeah, it was good. He covered everything. But did you ask about his joint pains that you were telling in case presentation?
No, no, he didn't
No,
ask
he
about.
didn't.
I asked about, I think about back pain.
Yes, but not the joint pains.
No, there's been
So
pain.
it's a request. If you don't ask anything in history taking, don't mention it while presenting
Yes,
your
yes.
case. It gives a bad impression.
Okay. Sure, ma'am. Yes,
Yeah.
yes.
So just keep this in your mind. Ask only, mention only the things that you have asked in history taking that should be in case presentation. Otherwise, it was good.
Okay.
Excellent. You have
Okay.
mentioned everything. Yes. Anyone else
Ma'am,
want to give feedback?
just,
Yes.
ma'am, just in this 6 minutes, if we are asking questions, and should we summarize also in this within
No.
this 6 minutes,
No.
or do we get?
No, 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 not in history taking. You don't have to summarize it. That is for communication skills. It's another thing. In history taking, you
Ma'am?
only have to take complete history, and your history should end on ICE, idea, concern, and expectation, like yours did. And
Ma'am,
if you miss,
that's
yes,
fine.
yes.
After that, you just asked me to summarize, right?
Oh, I asked you to present your case. I did not ask you to
Yeah.
summarize it.
I'm sorry. Present my case. So the
Yes.
presentation comes in this 6 minutes or after the
No,
6 minutes?
it comes after 6 minutes. So
Okay, ma'am.
here you are little relaxed because presentation comes after 6 minutes in the last 2 minutes.
Okay.
30 seconds, your presentation should only be for 30 seconds. Your presentation was more because you started talking about joints and all things, the questions that you didn't ask him with history taking. So never mention those. In 30 seconds, you'll present your case, and the remaining 1 minute and 30 seconds, you'll answer the 3 questions of your examiner. Hardly they'll ask you 3 questions.
Okay, ma'am.
Diagnosis,
What's the
provisional diagnosis, investigation, and management or treatment.
Mm-hmm.
what's the difference between presenting the case and summarizing it?
You don't summarize, you summarize your thing to the patient. You don't do it for your consultant. You present your case in front of your consultant. So here examiners are your seniors. Once you have taken the history from a layman, then you present it to your senior in medical terminology in that language. But in
Should we
summarizing, yes.
should we start presenting at the time we finish the history taking, or should we wait for the examiner to
No,
say that?
as soon as bell goes, leave
Yeah,
everything.
you
This is
didn't
what
have
I'm
a
trying to you. As
you
soon as,
didn't have a time.
yes, you
There is
don't
no
have that
time.
much time. No one will instruct you or guide you or tell you. They'll just stand there and watch. They'll sometimes they don't even give impression. As soon as at 6 minutes bell goes, drop everything. Leave the forget the patient. Patient does not exist. You'll turn to the examiner and you'll start presenting your case, and your presentation should only last for 30 seconds. Summarize it, make it small. In 30 seconds, just like a machine gun, you will just saying, today I examined 54 years old man with the complaint of difficulty in swallowing of liquids, solids, and
Mainly
then liquid.
positive things,
Yes, just the
mainly the
positive
positive
ones.
finding.
Only positive that you have asked as well.
Asked. Yes.
Asked as well, okay? Because examiner, there'll be two examiners. One will be listening to your knowledge thing, that if you're asking the relevant questions, if you're doing the right thing, and the other examiner will be observing your communication, how
Communication
you
skills.
communicate with the patient, how do you take the patient, how patient takes you. Because sometimes if you are asking a question and patient feels irritated, and if patient minds it, then the examiner will fail you because you have made the patient feel offended. This is what they don't want to happen. So that's why
But
two
even
people will be there. Yes,
I
please.
hear after you are going outside, you ask the patient, "What do you think about the doctor? Is a doctor or no?" Ask the simulator about you.
Similar.
Yeah,
Really?
yeah.
So see, so they even do that. They take the vote from your patient, and then they decide if they want to pass you or not.
Mhm.
Yes, here, and here is your question. You have read and understood. Kindly begin your history taking.
Hello,
Hello.
my name is Dr. Zaid. I'm one of the doctors here. Could I confirm your name and date of birth, please?
Yes, my name is Gracie, and my age is 19 years.
Nice to meet you, Crazy. How I can help you today?
Doctor, today I have this a lot of pain in my tummy.
I'm sorry to hear that. Are you now in pain or you need any drug to relieve the pain and talk to you later on?
No, no, you can carry on. I already have some medication. Now I'm better. I can talk.
Okay, that's great. Could you tell me more about the pain?
Yes. So today morning I had this lot of pain in my tummy.
Okay,
So along with that,
where,
yeah,
okay, where is the pain? Could you point out where is the pain?
it's mainly over here on the right side.
On the right side. Okay, does the pain all time there or move to anywhere else?
No, it did not move much, but when it started, it moved to back.
Okay, start in the right area, can move to the back.
Yes.
Could you describe the pain?
I
It's
mean, it was
colicky,
very severe. Yeah, yeah, it was colicky.
it was colicky. Is it come and go or all time there?
Most of the time it's there. It decreases with medicine, but yes, most of the time it's present.
Anything that make the pain worse?
Mm, Not really. It's there all the time.
Anytime that can be relieved the pain.
Uh, no, no, it's there. It's quite
Okay.
painful. It's not relief.
Okay. If I give you a score from 0 to 10, 10 is excoriation pain, 0 is no pain. How did you rate your pain?
It's 9.
9. Oh, it's okay. Anything associated with this pain? Have you had any change of your bowel habit? Any diarrhea?
Yes, yes. Twice I
Okay.
had loose motion.
For how many times?
2 times.
Do you notice any blood or phlegm in your
No,
stool? No.
no,
Did your pain relieve with bowel motion?
no, no. It's still there.
Any heartburn?
No.
Any vomiting?
Yes, I vomited. Actually, I'm feeling nausea right now also, and I vomited once.
Okay. Any skin rashes?
No,
Any joint pain?
no, no, doctor, nothing like that. Everything else is fine. Just this pain is so much worrisome.
Okay. Could you move during this pain or just you try to just sit calm?
I want to sit, though if I need to, I can move around a little bit. Most of the time, I have to lie down.
Okay. Did you have any sore throat before?
No.
Any change of your appetite?
No, doctor, not before that. But right now, I don't want to eat anything.
Have you
You know,
experienced
this pain is so severe.
Okay, have you experienced the same episode before?
No, this is the first time.
Did you visit your GP for any reason?
Just for this pain?
Okay, have you had ever do surgery before?
No, doctor. This is the first time I'm visiting the hospital.
Okay, who do you live with you at home?
My parents, my mom, my dad, and my brother.
Okay, I want to ask you some personal question, if you don't mind.
No, doctor, sure. Please ask.
Have you had any partner?
No. I live with my parents.
Are your menses regular?
Yeah, they are. That's perfectly fine.
Do you remember when the first time of your last menses?
Yeah, it was on 9th of this month.
Okay. Do you smoke?
No.
Do you drink alcohol?
No, doctor.
Have you traveled abroad recently?
Could you ask that again?
Have you traveled abroad recently?
Traveled
I did not
abroad.
get you. No, I did not. I was at home while I had this pain.
Okay, I want to ask you some question related to your body system. Have you had any chest pain?
No, doctor.
Any headache?
No.
Any joint pain?
No, doctor. Everything else is all fine. It's just this tummy pain which is actually making the problem.
Okay, what do you think the cause of this problem?
I don't know, doctor. I really don't know. This is the first time this has happened.
Any particular thing you are worried about?
No, just this problem I want to get rid with.
Okay, thank you.
Thank you, doctor.
Can you present it?
Today, I took a history from lady. She is complaining of right iliac fossa being radiated to her back. It starts suddenly with two bowel motions, watery, without bloody urine, and 2 times also vomiting and nausea. She didn't have any change of her appetite. This is the first time. She didn't have any previous episode like this. She is well and fit. She didn't smoke or drink alcohol. She didn't
So
have
what is
any
your
yes.
differential diagnosis?
My main differential diagnosis could be appendicitis. It
Okay.
could be ectopic pregnancy, UTI, renal colic.
Okay. How would you manage this patient?
I will take a full history examination. The patient sent for her blood test, CBCSR selective protein. I will also organize for abdominal ultrasound and CT scan.
And what treatment can you offer to this patient?
I will treat the patient accordingly. If she is appendicitis, I will organize for appendectomy. If she is a ectopic pregnancy, I will arrange with gynecological and general consultant. After the general stabilization of the patient, give her a pain relief and fluid and antibiotic.
Okay, good. Just 5 seconds. You answered everything within time. Very good. Okay, feedback, Dr. Pravijit. You can give feedback first.
Yeah, that was a very good history, very mindful also. And I think a lot of things are covered. Maybe a few things, but it does not matter much. But I think in the differential, there are two things: acute pancreatitis and acute cholecystitis. These two.
Cholecystitis, yes.
I was actually trying to
Thinking,
give the history for that,
yeah. I
and
noticed.
that was not actually added in the differentials, but the rest of the things were fine.
He mentioned ectopic pregnancy, whereas patient self told that
Was
patient
not
is living.
sexually
Yes, she's
living
not
alone.
active and was living
She
alone.
actually took
So
the history for that. You have any
yeah,
partner?
yes, he did. So why mentioned ectopic pregnancy? How can she get pregnant without a partner? So
I mean,
that
patient
was
can
wrong.
mind about.
Yes,
Yeah,
patient
Otherwise, we
can
are
get
giving it
offended.
in differential.
yeah.
Yes.
Anyone in
It should not have been in your differential diagnosis at all.
Differential.
okay.
First, okay, you said acute appendicitis. Otherwise, this one I think was acute cholecystitis. But then, okay, acute appendicitis as well, because 2 episodes of loose motion, all right. Retrocecal appendix can cause loose motion as well, nausea or vomiting. Yes. So, yeah, good.
The rest of the
Okay.
things were fine. It was good.
Absolutely, yes. Rest of the thing he covered within time.
And
So,
in time.
Dr. Yes, starting the timer, and here is your question. What? I'm sorry. I have to. Okay. There is some error. Okay, please begin. Yes, your timer begins, and here is your question.
Okay.
Right. If you have read and understood, kindly begin your history taking.
Okay. Hello, I am Dr.
Hello.
I'm Dr. Jaita, one of the surgical candidates. May I please confirm your name and age, please?
I'm John. John,
64 years
64
old.
year old. Yeah. Sorry.
Oh, hi, John. Hello.
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 Yeah, I'm listening.
Hi, John. Okay. So I'm asked to take a history to ask you what brought you here today. So may you please tell me what brought you here today?
Yeah. So, doctor, I've been having this belly pain in my tummy. It's really painful, and I don't know. I really have this difficulty passing
Okay, about that.
stool. It's really distressful.
Okay, I'm so sorry. So when did this start?
It started. Which one? The pain or?
Which one started first?
Yeah. So I actually I did notice a fresh blood in
Okay.
my stool for the past 6 months. But
Okay.
then what's really bothering me is the tummy pain, and also I think I'm a bit constipated for 2 days already.
Okay. Sorry about that. So before we proceed, do you want me to get you any painkiller?
No, it's fine. I can tolerate the pain.
Okay. So can you please tell me which part of your tummy pains more?
It's actually it's difficult to pinpoint, but it's sometimes it's on the left side, but now it's all over.
Okay. So it started as sudden pain or it was gradual?
It's more of gradual.
So is it a sharp pain or a dull pain?
Sometimes it's sharp, but more commonly it's like more frequently it's more dull pain. I don't know. It's just difficult to describe.
Okay, so when do you really notice the pain? Like what makes it come more or what makes it go away usually?
I'm not sure, doctor.
You're not sure about that. Okay, that's all right. So you said then you started having can you please tell me on a pain scale of 1 to 10, 1 being the least and 10 being the highest, how much would you score as in the pain?
It's around 5.
It's around 5. Okay, that's all right. So you said you've been having blood in your stool as well. So and then which started 6 months now. So can you please tell me if it's mixed with the stool or it comes after the stool or
Sometimes it's mixed with the stool. Sometimes it's just blood coming out without the stool.
okay. So do you have any like when you go from to the loo and then do you feel like you want to go and then when you go you cannot pass through?
Yes.
Okay. Is it does this do you have any discharges associated with it? Like slimy stuff's coming out?
I'm not sure, doctor.
Okay, that's all right. So about the blood, is it if I ask you to quantify it, is it teaspoonful or is it more than that or like a tablespoon? Can you just just streaks?
It varies. Sometimes it's just a streak of a blood, and then sometimes it's like more than a teaspoon.
Okay. So have you been having any joint pain,
None, doctor.
any rashes on your body?
No.
Okay. Have you been vomiting?
None. No vomiting.
Okay, there's no vomiting. And then also, have you lost weight? Or have you noticed any weight loss?
Yeah, probably. Although I didn't really measure my weight, but I feel like my clothing is becoming loose.
Okay. Okay. So I'm going to ask you some other history about your general health. Um,
Okay.
yes. So
Sure.
have you ever had any surgeries before or been admitted in the hospital?
None, doctor.
Okay. Any history of hypertension, diabetes?
Yes, I'm taking lisinopril for my hypertension,
Okay.
and yeah,
Okay. That's all right. So any drugs? Are you on any blood thinners?
no, no,
Okay.
doctor.
Any drug allergies?
None.
Okay, so I'm going to ask you some other personal histories. Do you smoke or drink alcohol?
Yes, I do smoke.
Okay, how many packs in a day or how many sticks?
2 packs.
2 packs,
And I've been doing this for over 30 years, probably 35 years.
25 years. Okay, that's all right. So, do you have any family history of any cancer?
None.
No. Okay, is that neither? Okay, that's all right. So, any idea about your condition?
Uh, I don't have any idea. I'm just really concerned, hoping that it's nothing serious.
Okay, so you have a concern. What's your concern?
Yeah, mostly the blood and the pain.
Okay. Okay. How about your expectation? What do you
Well,
expect?
hopefully we'll be, yeah, hopefully we'll see what's the cause and probably give you medications, especially for pain.
Okay. Okay. That's all right. So thank you so much, Mr. John. I'll get back to my consultant and then we'll discuss the case.
Thank you so much,
Okay.
doctor.
Okay.
Can you present your case now, please?
I presented a 64-year-old male that presented to us with abdominal pain and then history of constipation. And then he also had a history of passing fresh blood whilst passing stool for the past 6 months. So, and there's also a positive history of he's a chronic smoker, and then also he has lost more than copious amount of weight.
So what is your differential diagnosis?
So my differential diagnosis is maybe colonic tumor, colonic cancer first on my list. Second, it could be a diverticular disease. Thirdly, it could be an irritable bowel, inflammatory bowel disease as well.
Okay, so how would you investigate this patient further?
I'll first of all start with I'll complete my investigation by starting doing the clinical examination, and then I'll do my full blood count, urea electrolytes. I'll do my ESR to find for any inflammatory cause as well. I'll also do my liver function test and then my renal function test, and then from imaging, I will do an erect abdominal X-ray. I can also do a colonoscopy for this patient to diagnose him.
Okay, colonoscopy plus biopsy.
Biopsy, yes.
Okay, what should be the treatment that you can offer to the patient?
So depending on the stage of the disease, I can either manage non-surgically or surgically. So if this patient is operable, we can do a resection. If not, we can also do palliative management for him.
Okay, good. Thank you. Just on time. Good. Thank you. Yes, Dr. Joshua, would you give feedback?
Yes, ma'am. I think Dr. Fatimata did a good job because she's trying to be thorough with the questioning. I can see that she's trying to think about the other differentials while asking for symptoms. Although I wish she could have asked about the like symptoms of hemorrhoids or
Yeah,
fissure.
yeah.
Yeah, and maybe just
And diverticulitis as well. Patient is 64 years old, so that could also
although
be.
although most of my answers are I'm not sure. Sorry.
That's okay.
Yeah.
It's
But I maybe she can improve more on the pacing so that
Yes,
she'll finish on time. But other than
yeah.
that, I'm happy with
She took 1 minute
her history.
extra
Yeah.
according to me, so I'm not
Okay.
happy. I need her to complete it within the given time.
Complete.
yeah, I will try.
Yes, you'll try it definitely. So,
Thank you.
oops, what's happening? Okay, starting the timer, and here is your question. Right, if you have read and understood, can you begin your history taking?
Hello, I'm Hana, one of the surgical candidates. Can I confirm your name and age, please?
I am Mrs. Linda Roberts. I'm 35 years old.
Nice to meet you, Mrs. Linda. Today I have been asked to ask you a few questions regarding to your condition. Is that okay with you?
That's all right.
Okay, how I can help you today?
So, doctor, I've been having this tummy pain for the past 1 day. It's actually really disturbing and it's very severe.
I'm so sorry for hearing that. you want to me give you some bills, or you can continue the history?
Yes, I would appreciate that.
Okay, then, okay, can you describe this pain, please? Can you pointing where in your tummy?
So I have this pain. It's in the upper part of my tummy, and it's very, very painful. Yeah, and then the pain goes all the way to my back.
Okay, is the pain start gradually or suddenly?
It was sudden. It was sudden. It was sudden. It was just yesterday.
Okay, is anything make this pain more increase, or anything make it decrease?
Yeah, when I lean forward, the pain decreases, but when I'm just lying down, it really pains. It really hurts.
Okay, if there is a rate from 1 to 10 and the 10 is the worst, can you rating your pain?
9.
Okay, I'm so sorry for that. Okay, there is any thing associated with the pain? You have any throw up or any increased bowel motion or anything?
Yes, I've been throwing up. I had like 3 episodes since yesterday. I've been throwing up, and then I've been feeling like still vomiting, even with that.
Okay, this vomiting, there is a blood in this vomiting,
No,
or just food?
no blood, just.
Okay, okay, you have any increase in the bowel motion?
No, not really, but my the stool sticks to the toilet roll, or to the yeah.
Okay, okay, what about your color of the stool, the color of the stool? It is pale or like yellow or something like that, or
Yeah, it's just normal.
just, okay. Okay, there is any feeling of acid in the back of your mouth or your throat?
No, no feeling like that.
Okay. Okay. What about your? What I can ask? What this pain come before, or this is the first time?
This is the first time.
Okay. Okay. When you eat a fatty meal, it is increase the pain or not related?
Oh yes, the pain increases.
Okay. You have any noted any change in your in your eyes, like yellows? Or...
No, my eyes are normal.
Okay. Okay. What I can see. Okay. You have visited the GP before.
Yes, I have.
What?
So I am a diabetic patient. I've been on medication. Yes, and I've been
Okay.
taking morphine for pain relief. So
Okay. Do you have any surgery before?
no, no surgery.
Okay. Do you have any allergy from any medication?
No, no allergies.
Okay. There is anyone of your family have the same situation?
No, no one.
Okay. Can I ask you some another question? Do you smoke?
Yes, I do smoke.
How many?
A pack a day.
Okay. Do you drink alcohol?
Oh yes, I drink a lot.
How many units per week?
I drink about half a bottle of vodka per day.
Okay. Okay. Who live with you at home?
I live with my husband.
Okay. Do you work?
Yes, I do.
Okay. Okay, do you have any chest pain, any burning and micturition, anything else you are?
No chest pain. No.
Do you have any joint pain or
joint pain.
muscle pain? Okay, I think I finished. Okay, what is your what do you think you will have?
Actually, Doc, I don't know what's wrong with me. Just that the pain is very severe, and I want to know what's happening.
Okay, what's your most concern about?
About the pain, I'm concerned about the pain.
Okay, what do you what you want from us? What do you expect from us to do for you?
To take care of my pain and to tell me what's causing my pain.
Okay, okay. If you have any other question,
no, I don't.
Any ask to add?
No, I don't.
Okay, thank you. Today I had take a history from Linda report, a 35 years old lady. She have upper abdominal pain related to her back from one day and have 3 episodes of non-bloody vomiting, and he have steatorrhea, and also the patient diabetic, and she smoke one pack of smoker 1 pack per day, and take half a bottle of alcohol per day, and the Bennett score about 9.
So what is your differential diagnosis?
My first differential diagnosis is acute pancreatitis, and it may be acute cholecystitis or peptic ulcer disease or ascending bronchitis.
Okay, how should this patient be managed?
Okay, after full history and examination, I will go for some investigation for ERCP and abdominal ultrasound, and take a blood test for blood count and urea electrolyte, and after that, if the patient need for CT, I will go for CT.
Yes.
And I will manage it. I will first start by fluid resuscitation, give the patient fluid and painkiller. The patient on the pain, I will start it according to WHO letter of the pain. Then I give non-steroidal, and if not relief, go for mild codeine, and then for morphine. And I will encourage the patient to stop smoking and alcohol.
Yes.
And what else? And also the patient is in acute attack, I will give antibiotic, and the patient should be MBO.
The patient takes morphine, a lot of morphine. You actually didn't ask.
Oh, okay, sorry.
So 15 to 30 milligrams patient takes. So how 30 milligrams patient takes. So you have to send the patient to psychiatrist or?
Yeah, I will treat the addiction, help the patient to also to stop the, what I can say, I don't know.
Yes.
Again, the question, please.
Questions are finished. Bell went. Very good. First time you have presented, and it was excellent. It was tough. It wasn't an easy question. And then, yes, missed.
Question systematic. Okay. Thank you, Mom.
Yeah, it was your first time and it was really good because, yes, Dr. Kashif, you raised your hand.
Yes.
Dr. Kashif, you want to give feedback? Maybe he forgot after raising hand. Okay. Yes, it was first time, and then considering it a difficult station, you did really well. One thing that you were, when you were presenting, you said patient has pain to 9, but I don't remember you asked the patient in the scale severity from 0 to 10. I didn't hear it.
Yeah, he
Yes.
sorry,
She
she
did.
did.
She did. Okay.
But she when I told her that I had pain and then I needed painkiller, she just
Yes.
said okay, and then that was all. So she didn't arrange for
No,
anything.
did she ask you the severity of pain, like from
Yes, she did.
scale of? Okay, okay. I missed then. Okay, because she was telling, and then I thought maybe I didn't hear it, so I wasn't sure.
Yeah, she did. She did ask me.
Yes. Okay. Good. Thank you. Yes. So yeah, so the more you'll practice, Dr. Hannah, you'll become more confident, and it's just the first time, it is difficult. Second, third, it will become more easier, and the more you'll practice, the more perfect you'll become. Okay.
Inshallah. Thank you, Mama.
Inshallah. And you're not giving exam in May, right?